Unlocking the Secrets of Heart Health, a guide to reading ECGs for everyone. Hello everyone, I'm your host Dalvinder Kaur from Lovely Professional University. Get ready to dive into today's topic, that is decoding your heart's rhythm, understanding electrocardiograms, ECGs for everyday people. Before we proceed further, allow me to introduce the experts of the day. Dr. Thigarajan Subramaniam, Professor, Department of Physiotherapy, LPU. With over 2 decades of experience and a wealth of academic achievements, Professor Subramaniam will explore the role of physiotherapy in managing conditions like asthma, tuberculosis, and more. So now, I would like to introduce the admission nominee also in this webinar, Mr. Rishabh Sharma, Officer and Area Coordinator at the Department of TIABS, North 1 Division of Admissions. Mr. Sharma plays a pivotal role in connecting the universities with various institutions and organizations. Before we proceed further, I would request to everyone, for any question you can write in the chat box or in the Q&A box, and same will be addressed from my side in the end of this webinar. And now I hand over the thanks to Dr. Subramaniam, and it would be an absolute delight to listen from him. Over to you, sir.
Yeah, thank you. Thank you so much, ma'am, for introducing me for this particular event. And thanks once again to the LPU for giving me the opportunity consecutively for the second year also for sharing my knowledge to all the mankind. Of course, the beginners to the profession, also existing to the profession of physiotherapy, or people who are liking to want to improve their health, especially preventing from the sudden cardiac death. Let me share the PPT so that we will get a So I always prefer to take a first important point in every webinars, the importance of the particular topic. Okay, you know very well about that. People participating in the large events like marathon running, and the people nowadays are doing a lot of workouts in the gym, and people participating in the more freak in the physical activities when compared to the past. After COVID pandemic, so we faced a lot of changes in our life. Of course, now we are facing some bitter experience, such as a sudden cardiac death. Yeah, do you know what is sudden cardiac death? Okay, let me reveal. The heart has a function of the pumping the heart, blood pumping from the heart to the entire part of the body. Okay, so similarly, some of the functions behind the heart, so how it pumps the blood to the entire part of the heart. So that is really a challenging one, and it's a very complicated one. So how it is conducting the impulses. Okay, if someone have the difference between the concept of heart attack and sudden cardiac arrest. So people not identify the difference between these two. Okay, so in order to identify, so I just want to specify some of the few informations which we are going to run through this particular topic today. Yeah, actually what we are going to use it with the specific part of this learning objectives. So we are going to discuss about the basic about the cardiovascular system in a very short crisp, and how the electrocardiography, which will be helpful about the helping or diagnosing the problem. Okay, because as I told already, sudden cardiac arrest. So people die, and many of the people, they never get into the chance of the revoke back, or they will be alive back. Okay, so this is the reason. So we have to diagnose priorly. So how we are going to identify those problems in a single shot? That is the one way. This is the complete objective, or as well as the outcome of this particular class. So as you know that the heart, which is a complicated structure where it is pumping the blood through the body. So the pumping sequence, okay, normally it happens with a normal pumping activity. So we can call it as with the cardiac cycle. Every period of the time of pumping the blood from the multiple chambers. As you know that there are 4 chambers in our heart. So these chambers, so which helps into the pumping the blood into the various part of the body. Okay, so when particular part of the chamber, when it is contract, so it requires to record it into some kind of the electrical activity. So that electrical activity measurement, which is called as ECG. Okay, some countries they use the EKG also synonymously. And this is the one which helps into the diagnosing the problem. Okay, rather than some of the investigations, some of the techniques can be helpful for treatment as well. For example, angiogram, angioplasty. Okay, nowadays people very commonly aware of this terminology. Angiogram is nothing but where there will be a heart block can be identified through the a probe inserted into the blood vessel. Okay, it is a little bit expensive and cost very technically required skill required for doing this particular procedure. But prior to that angiography, this ECG is a predictor to identify how the heart will get affected. So what happens with the changes in the cardiac abnormality. So these things we are going to discuss over there. That is the mainly for the identifying the problem. Okay, so diagnosis is nothing but identifying the problem of the patients. Okay, and another important thing. Okay, so every time we require a cardiologist when we check the ECG reports, not required. Okay, not always required. So we require some of the person who is having the medical knowledge, experts. Okay, of course, one among them is a physiotherapy practitioner. Okay, you can ask your doubts also for your in case if you are facing some issue in while doing the gym activities. You can talk to the physiotherapist. They are the one who studied 4.5 years in the bachelor's program and 2 years in master's program, and also they do PhD in this area where the cardiorespiratory PhD people, so they can help you in better way how to identify. So for that only, I am just sharing that information about the how to identify the rhythm of the heart. Okay, with the using the identification of the rhythm of the heart, so we can predict what part are the possibilities of the problem they may develop. Okay, so this is the one chance if you become a physiotherapist or if you are going to start your own practice after your physiotherapy, this is the one area which we are going to focus. Yeah, and some people directly face some kind of symptoms. Common symptom is chest pain. Okay, the chest pain can be caused by many reasons, so not always panic. Okay, but if you don't aware, you should be panic after you lost something. Okay, if you miss in some other system, so we can just have a time to refill or we can revive back. But anything if you miss in the heart, so it may lead to the loss of the life. So that's why it is most important. So why I have to know about this, the rhythm of the heart. Okay. So if anyone complains with chest pain, irrespective of the pain may be in the left side or pain may be in the right side. So it doesn't matter. So anything below the lower part of the ear and below the neck, back of the neck and shoulders and in the till the up to the nipple level. If you have any site or any area around the chest also, you have to always suspect for the cardiac problems. Okay, so that's another important. This information. It is not only for a student, not only for if you are anyone who is watching this particular webinar, so who can also help to know about your. Okay, of course, once we start giving the treatment, so this is a one we are going to use to block the thrombus or the some clots inside the blood vessels. So that should be broken down into multiple pieces or diluted. That we call it as a thrombolysis treatment. So that also can be helpful to identify whether there is a proper the way of the thrombolysis is achieved or not. So this is the basic of the ECG, what actually helps in our clinical practice. Yeah, as you know about that, yeah, in your students who are appear for the NEET exams, students who are appeared for the All India pre-medical test exams. Okay, so they always know about the importance of the history behind this electrocardiogram. So it was a vast history, not now. It was a vast history of invention of this particular invention of this particular diagnostic method of ECG. It is a quite interesting one. Though many people, you can see the many people who are listed here with the French scientists, Italian scientists, Irish scientists, Okay, all the names are listed out, but we never ever forget the person who is none other William Einthoven, who is the one who is developed a modern ECG method. Okay, so that was a great Nobel effect on this particular invention. Okay, so he got the Nobel Prize because of this invention of the EKG or ECG. So, and one of the famous person, so how they used it. So you can have the, just I want to give acknowledgement to him always. So I just want to show this picture. Just imagine it was the old type of the ECG. Okay, so I can also suggest how the ECG can be helpful to the entire society, or how it is now evolved in a multiple type. Okay, I can show you that there is a ECG in my just smaller than the palm. Okay, you can see here for the, yeah, it is just lesser than the, yeah, it's just for your almost your earpod size, airpod cap size. Okay, now this is the ECG now. This is a device now we are using in our clinical practice. We are giving a training using with this ECG devices, and we are giving a lot of students to undergo for the sports athletes undergo for this training as well. Okay, so now you come to know this, the importance of this webinar. So how it will be helpful to you. I hope just wait. We'll just see more information about the ECG, how we are going to decoding this rhythm. This is a modern instrument which we have in the most of the hospitals. How they use us. Of course, we do have some of the instruments similar to that also, and also we are going to check how this conduction impulses carried out from our heart functions. Okay, so basically, the contraction of the heart, so which we call it as in the form of the discharging of electrical charges into, we call that technically we call it as a depolarization. So usually, what happens, the when you place the leads or electrodes in our body, so it will pick up the signals and detect the heart function ability of the contraction. So it can help us to pick up the idea of how the conduction impulses are traveled. Okay, this is the one thing which we need to focus. So as I told already, it has a four chambers. The upper two chambers we call it as the atrium, and lower two chambers, or we can call it as the ventricles. Okay, so the both the atrium and ventricles together it gets the contractions impulses from the two different points. So one is we studied in our school time also. It is nothing but it is a SCA node, sinoatrial node. So it is also almost in the right side top of the right side chamber of the upper chamber. So this node will be present, and next node is which is present in the junction between the upper part of the heart and lower part. So between the upper and lower part of the heart, so there is a AV node is present over here, and under these there are a few bifurcation of this cardiac the bifurcation of this both the right and left side of the ventricles. So that is called bundle of His, and the fourth one where there will be a it supplies the entire chambers side lateral side of the or outside of the chamber. We can call it as a bundle branches. So like this, we have the standard method of the spacing of the heart, or it's called wiring of the heart. So how the conduction will takes part in the wiring of the heart. So because of that wiring, so what happened? The strength of the muscle contraction, like cardiac muscle contraction. So we develop the some kind of the wave representations. So in terms of the contraction of the upper chamber muscles, and when followed by the where there will be a lower chamber contraction, okay, with the ventricle chamber contraction and ventricle relaxation. Okay, so these three portion which forms in a graphical representation that is called P wave, QRS complex, and T wave. Okay, this I can show in the picture so that in everyone they might see in their near and dear for they went to the hospital, those who are already tested. Okay, so you can see this wave pattern. This is called ECG wave. Okay, how many of you heard about this wave pattern? Yeah, you can put in your message in the chat box or in your YouTube. If you are watching it in the YouTube, you can also put your message in the comment section. Yeah, this is a P, QRS, and T. If you look at that P wave, so where we have the major part of the Yeah, this portion which gives the upper chamber, contraction of the upper chamber. Okay, and this one QRS is a lower chamber contraction, and the T wave which gives the information about the lower chamber relaxation. Okay, there is a one thing is missing, that is the atrial relaxation, that is upper chamber relaxation, which is not mentioned here because the strength of the upper chamber relaxation is very low. It is submerged by this area in the QRS. That's why it is not visible here. So we have a three major point of uh, the waves, which P wave and QRS and T wave. Okay. Yeah, sir. Any disturbance in my voice?
No, sir, no.
Okay, okay. Shall I go in this? Yeah.
Yeah, you can go with the flow. You can continue.
Okay, okay. Thank you. Yeah. These are all the small technique which we can guess what is happening in the ECG interpretation. Of course, if you are already bachelor student of any stream of student, maybe you are going for a bachelor of medical laboratory sciences, or bachelor of pharmacy, or bachelor of Ayurveda. If you are going for some other, so you can always look at this one, how we can able to identify the different variations of the sheet which we are using it. Of course, we are going to see this similar kind of the graphical representations, which is helpful to identify the difference between the one particular wave to another particular wave, which I have mentioned this wave. Like this, multiple waves we are going to see for the identification of the ECG. Okay, so at least as a common man, or as a bachelor student, okay, already licensed students, any kind of licensed students, maybe a diploma or degree, or with any medical laboratory sciences, medical sciences students. Of course, MBBS students also required to know about this. So we have a lot of opportunities. Those who are passed out from MBBS or any other medical degree, also we can study more about this ECG variations. Okay, so here this is the one thing, just giving the information about so how this each and every graphical sheet helps us to identify the accurate rhythm of the heart. Suppose this is actually one box is there. So this box is the bigger box compared to the smaller box in the inside in it. Each big boxes which consist of the 5 small boxes in a row and as well as a column. So it will be around nearly about the 5 total 25 number of the small cubes inside the one square, big square. Okay, but each the measurements are given here, which gives the information that the distance or difference between the one wave to another wave, one point of wave to another wave. So like this, it is given as a 0.04 second, 1 millimeter. Okay, whatever it is given. So the in the horizontal direction is the duration of the passing of the wave, and vertical direction, so which gives the information of the strength of the waves. Okay, so that is the few identification for the interpretation of the ECG. Okay, see. So you may have a question. So we have a very nice wave here. So why it is showing like this? This is the challenge when we are facing the real time. So the previous one was the animated one, what we study in our books from your school time onwards. Of course, in the school time biology course, so you will get the same similar kind of the images. Okay, but this is the one what we are going to face in the real time. So real time image is slightly little different than the textbook what we studied in the textbook. Okay, so that's why we have to use it for this particular one with the ECG device. When you use this ECG device, and which should be connected with the multiple part of the body. So that is a triangular shape of the image which we are going to connect from the ECG waves. So we use the multiple electrodes. So using with the small adhesive electrodes. Okay, we are connecting this with the device with the our body. So which can help us to give the multiple levels of the leads. So I have shown you the only one lead. So you can see that the same thing what I have shown. This is the one. But when you see here, it is not same like as it is in the. This is actually a person's. Okay, the person who is a normal person, human living person. So for either the printout is taken from the particular patient. Okay, and of course this will be connected with your the ECG will be connected by using the a connector and using with the device So simply we are going to use it for the application of using with the mobile application. So we are going to use the mobile applications and to use the method for bringing the all the information report on your hand within 2 to 3 minutes. Within 2 to 3 minutes, you will get a report on your mobile phone itself, and you can share to your expert. Or if you are doing workout in your gym, you can share to the fitness physiotherapist who is a senior fitness advisor. So he will help you to identify what is the problem in your heart. Okay, so this is one of the unique device. So why I am again we are going to insisting. So this is an interesting fact of the ECG device. Okay, let me go into the little deeper. Yeah, see, this is actually how we are going to identify the rhythm by seeing the heart rate. So this is actually the I told in the previous slide where there is a one box for each one box of the big box. So that which gives the information how many number of the boxes in between the one particular interval to another interval. You can see in the previous picture. So in between this is the area between one to another. You can very tall waves are there. No? So between the one tall wave to another tall wave, so we can identify. So what is the how many number of the boxes are present? So based on the number of the boxes, so we can say that if it is one box is present, the heart rate is 300. It is unbelievable. 300 heartbeat. If normally if a person who develops, it's really a dangerous one. And if you see that if there is a two box, it is 150 is a heart rate, and if it is three box, okay, so it is 100 heartbeat. Okay, based on the measurement is taken from the a formula 300 divided by number of the boxes. Okay, so I just want to give you the glance of all these points in a nutshell only. So more informations you keeps on posting in the our pages, and don't forget to miss our all the subscriptions and as well as for the newsletters released by our LP Physiotherapy. Okay, and you can just check these one all the normal heart rate, how we are going to identify the heart rate. Okay, so now the heart rate is the one which we have seen now. Now the heart rate rhythm, I'm just connecting. I'm trying to connect with the showing the rhythm. Just give me 1 second. Yeah. See, normally we have the rhythm in the sense if there is a regular rhythm, that means every tall wave, one tall wave to next tall wave should be equal distance than the another tall wave. So if you see that in the previous, uh, yeah, like this. So this is the one particular, this from this to next tall wave, if it is there, the QRS, this should be equal distance. Suppose in the previous one is also tall wave, so it should be equal distance. If it is there, we can call it as a normal sinus rhythm. Okay, same like this, the heart rate also 60 to 100 beats per minute. Okay, and as well as the other parameters of the waves we need to address. It's a normal sinus rhythm. Yeah. Suppose if a person, if you are a regular marathon runner, or if you are a fitness interested, or any sports person, if you are participating in event, okay, so in that situation, so your heart rate will be always lesser than the normal. Okay, or below the 60 beats per minute, we can call it as a lesser low heart rate. We call it as a bradycardia. Okay, so generally when we see this any kind of the bradycardia, so patients always having a low heart rate, 40, 50, 60. So people used to do with the regular exercises or being a sports person. So they develop this bradycardia. So this is normal for them. Okay, if it is for that means the person who is not a regular player, or if they are not having any physical activities regularly, or the person is um, yeah, a sedentary lifestyle person. So if they have the heartbeat less than 60, then you have to immediately call for the medical attention. Okay. This I'm just giving a awareness only. I'm showing this one information. Maybe some few students who are new to the medical profession, so you may require some background knowledge to understand it more in a comfortable way. Okay, for the bachelor's program person, I think it's more than sufficient to understand what I have shown here. Yeah, this is actually in the, if you see that there is a rhythm will be always having the gap between the one uh, in- tall wave to next tall wave. See, one tall wave, next tall wave. So if it is more than number of the boxes of more than 6 boxes, okay, if it is there, so then there will be a bradycardia. We can call it as the bradycardia. Yeah, bradycardia means low heart rate. Lesser heart rate below 60. Direct opposite. If someone is having with the increasing the heart rate, so that increasing heart rate we can call it as a sinus tachycardia. A sinus tachycardia is nothing but here more than 100 beats per minute. So more than 100 beats per minute, how it will looks like that, and as well as the person who is having with the more tall wave, all tall waves, so which is having with the lesser distance between the two tall waves. Okay, you can see here, for example. Yeah, look at here. There is a less than three boxes in between the each tall wave. So tall wave with the less than three tall wave in each. See, look at that. Only one, two, three. Okay, then it is about more than 100 beats, or is it two? Here only two only is there. Okay, so more than 100 heart rate, which we are seeing it in this situation. So there is situation below 60 heart rate and above 100 heart rate also. Suppose if someone is doing exercises, running in the gym for the treadmill, okay, definitely their heart rate will be increases. Okay, we cannot comment that is the one. Okay, that is not tachycardia. That is actually a temporary increasing of the heart rate due to the workload. Okay, so it should be checked always when a person in a lying flat and resting position only. This kind of informations which we can say it is a kind of the affect. This is the major issue we are considering about. This is a very critical situation, or which can be help identify the, or it requires the attention. Okay, this is the one way what we have to identify from the various uh, analysis of the rhythm of the heart. Okay, if you have any questions, you can post it in your chat box or in the comment section. So about if how much your heart rate, or have you used any gadgets if you are using, or if you are using some of the smart watches, or if you're using some of the medical apps, iPhone, Android apps, so which using for checking your heart rate. Okay, so if you are using it, just please post your comment on the any of our this video link or under the comment section. So usually what we do, we have the cameras usually want to view something. Similarly, the heart also require to see in a different angle. That's why we have seen in the previous picture of ECG where there are a lot of number of so the groupings of the waves, so which makes us more confusion. So technically, if you are already a medical student, so it is definitely you will know very well about this method of why they are keeping it separately. If of course, if you are a beginner to this medical profession, this is the one way by taking the picture. How we are taking a picture to view about the different position of the heart. Okay, so this is the way we are going to see the different portion of the heart. So what we can use it as a compass box. So to reach the entire part of the heart, how we are going to see the different part of the heart. That's why the needle act as a different portions. So here we have the different methods of the needles are there, and that needles will be connected with the each and every electrode which I have told you. Like this, we are going to place in our chest, around the chest area. Okay, from the entire part of the chest area, we are going to place. I'll be showing that where we are going to place it. Of course, this device, which is helping for the ECG device, so this will help us to even if you are a non-medical person, if you are new to this particular profession, so this will assist you where to place the electrode, how to place the electrode. So everything will be given in a very simple way with animated view when you are connecting before connecting to the patient. Okay, so this will help us to identify. Okay, actually, this is the reason why we are using the map, or why you are using the using like a compass. Compass is the one which help us to identify different areas of the ECG. Okay, so here we have the different walls of the. You can see this the light green color one. Okay, that is a side wall of the lateral we can say, and the light green color one, which is the wall of the heart. One side of the left side of the heart with the lower chamber of the heart, so which will be covered in this part of. And the yellow colored one area, what you are seeing in this picture, so that is the one area where we have the different part of the lower part of the under the in the heart area, that particular heart's contraction, and also the any disturbance in the contraction, so that we can able to see. Similarly, all the front of the heart, okay, and also front of the heart or the central part of the heart. So like this, it can help us in a different way to identify the actual contraction of the heart. This is actually little clear ECG strip. Of course, this is also little bit redrawn, recreated ECG, but still there is a wave pattern is different from 1, 2, 3. Different is there, so it is quite. It is not easy for a common man to by seeing the graph and analyze the graph. So you require if you want to become expert in analyzing this. Of course, you have to choose some of the medical courses which is helping to understand about ECG. Okay, and also there is some of the rhythm strips also given over here. So the rhythm strip is the one rhythm strip also given in the mobile application itself. So which will gives you the whether it is a normal rhythm or a normal rhythm. So by checking, even if you don't have any knowledge about the ECG, of course you can use this device. So this device is which is available in the market. Of course, it can be useful for us to, but we require if you are going to study or if you want to study about ECG in detail, so this is the one device which is available in the market, and we'll be giving a training programs for this particular ECG training programs also. Of course, it is a part of our physiotherapy program, so we are teaching all those things from the beginning of your classes. Yeah, this is actually a different places. There's nothing only about this medical terminology behind this, where it has to be placed, everything. So it's clearly given in the different locations of the part of the body. So accordingly, we can place the electrodes using with this the adhesive electrodes, which we are seen before also with this same electrode placements. Okay, and we are connecting with the cable, which is helping for this to measure it. So using the small cables, which are used for the connecting with the entire part of the heart. Yeah, these are all some of the things are we are how to identify the waves. So first, we have to identify the waves by its the tall waves are there, the R wave. We can say that the different tall waves, how it is develops, and what are the basic behind this, how it is developing, and what are the different format of these tall waves. Okay, so this will help us to identify more in deeper knowledge of the understanding about the which type of the problem they may develop. Okay, so maybe in the short time I can give you the short information. So we will be waiting for some more queries to address in the further classes. Yeah, these are all the different wave patterns which we need to for understanding purpose. I just want to share it here. Yeah. So basically, when you are going to start with your clinical practice after your basic medical degree or any other related medical degree, so you should know about that. So how we are going to analyze or identify the different rhythms. So, okay. So what happens with the patient's heart rate or the issue inside the rhythm of the heart, and how we are going to identify if the patient is having the abnormal heart or normal heart. So those things were small tricks. There are 9 tricks over here. Using with the 9 tricks, we can able to identify. So first thing is the ECG, whether the ECG is properly taken. Okay, that's called, we call it as a standardization. Whether the report is normal or whether the report is printed normally or first thing. Whether the printing itself maybe sometimes the queries. Okay, so in that scenario, so we have to check this for the standardization of the lead. So lead, whether it is leads are all the leads are there, but how we are going to see that one lead will be little different than the other lead. So you can see this in the overall the leads placement. Yeah, you can see here. So all the leads are having, so you look at that, it is showing above. The tall waves are going to a little bit going upward direction. The tall wave always going to upward direction. Most of the normal, you can see. See, in all the, you look at that, I'm just put the tick on the all the area where there will be mostly having with the, okay, so the upward direction of the tall waves. But you can see that all the waves are reversed, like a mirror image, only in the one particular lead. Okay, so if it is there in only one area, all the three images which is showing here, it's a reversed pattern of the. Okay, so this will helps to identify whether it is a right or wrong. Okay, so like this we can see that, and look at that. This is the standardization. If there is any square box or a rectangular box that is showing, so incomplete. Okay, only three sides are there. This is called the standardization of the printing, whether the print is properly done or not. Okay, then you should not worry about that. If anything is happened, the thing is misleading. Okay, if it is not there in your strip, so you must don't worry about that report. Okay, or advise the technician to take the report again. Okay, this is the one thing for a common person also should remember. Okay, and report is this is the only area where there will be this portion, we call it as a AVR, should be reverse. This area should be reversed one. These two are the basic point in the understanding about the standardization of the, look for standardization of the, and analyze heart rhythm. I told already, in between the two long tall waves, the equal distance, one tall wave, next tall wave, and third next tall wave should be equal distance. If it is equal distance, then that is rhythm is normal. If it is not equal, then it is abnormal. Okay, it is called arrhythmia. We call it as abnormal rhythm of the heart. And another one I have told you very simple way how to calculate the heart rate. Simple is how many boxes in between the one tall wave to next tall wave, then next tall wave. So you can take any two tall waves. Any two tall waves. Between you have to calculate the how many boxes. If it is a 3 box, it is 100 heart rate. If it is a 4 box, it is. Okay, 3 to 5 boxes is the normal uh, normal heart rate. Okay, not maximum. Between these 3 to 5 boxes will be the normal heart rate of the person. Okay, like this we can able to find it out. And some of the method how we are going to see that there is a same like our earth position. Heart also it is not locating like this. Heart is locating little bit slantly. It has just deviated like this. Okay, so it is very important. So we have to see that how much it is deviating to one side or how much it is going to another side. So it's very simply we can say that without opening the heart. Opening the heart is not possible at all, of course. So by seeing this ECG, which gives you the information whether it goes to deviating to one side or deviating to other side. So like this, we can able to differentiate the using with the axis deviation. This is one of the technique. Then, as I told already, the heart having a chamber, upper chamber and the lower chamber. Upper chamber, we call it as the atrium, and lower chamber is the ventricle. So in the upper chamber, if there is a not having enough electrical conduction, okay, there's a chance of the heart will become enlarged. One part of the heart will be enlarged. Okay, so to identify that also, we have a technique or trick to understand about the uh, T-wave morphology. So for more about this one, we can see in the other sessions. Okay. And there is a one more important thing. There will be a one atrium contraction and to ventricular contraction. So in between, there is a duration is there. So this particular duration can be analyzed to identify any block in the conduction of the heart. Suppose if they have noticed about the first degree a block, if it is there, if they keep on doing their work without consulting a doctor, without consulting a physiotherapist, okay, so without taking any precautions, they will go to the medical shop and taking the medicine. Okay, so these are all should be avoided. So for that, the sixth trick will be helpful to identify. And very, very, very important thing I told already with when there is a block in the heart, when there is a block in the heart, so there is a chance of the person can die on this spot. So that block can be constituted to there is a lack of blood supply, to the heart. So which can help us the information about there are some changes in the blood, the segment wave pattern. So that we can call it as ST segment and T wave abnormality. Okay, these things can help us to heart attack. How to identify the heart attack, that can be also helpful. And other than that, a person who is getting older person who may develop these, keeps on contracting it. We are taking a rest every weekend. Sunday we are taking a rest. Okay, and we are going for the weekends, and as well as the year end, we are going for the two vacations, summer or winter vacations. But only one organ. Okay, it never takes the rest. All time it keeps on work. There is a heart. Okay, so it keeps on working for many years. It keeps on pumping. So the muscles of the heart getting stronger and it is getting thicker than the younger one. So in a person who is the older one who develop the thicker heart muscles, okay, so that we can call it as a hypertrophy, the enlargement of the heart in the chambers of the lower chambers, okay, ventricles. So that can also can causes sometimes the abnormality between the elderly population and as well as the younger population. Of course, there is a possibility of this one. This eighth trick, which help us to identify a person who is younger population who is having this thickness of the heart. Okay, they may go for the chance of these sudden cardiac issues if they are the players. Okay, that's why you have seen the many of the videos. Suddenly they fell down in the field while playing the football or cricket, okay, or some other physical activities. So the people die of the heart attack. Okay, it is not heart attack; it is a cardiac arrest. Okay, so that in that situation, the person can die and reviving the life is a challenging one. Okay, and last trick where there is a block, where there will be a conduction. Suppose the blood supply is affected, then if the block is happened, so that is a different scenario. But when the conduction is affected, means the electrical activity, if it is stopped, that we can call it as a cardiac arrest. Okay, so for that there is a one more trick for the ninth trick. We are going to use it with the different types of the blocks. Okay. So this is actually a nutshell outside of very short information about the revealing the rhythm and rhythm variations and how we are going to decode these all the ECG. Okay. So I think with this I just stop for that session now. So if you have any queries, keep on posting in our comment section. Of course, in any format, any social media handle or wherever it is there, definitely we will address your queries. Of course, we share your email IDs, so our team will definitely help you to solve your doubts. Thank you so much.
Thank you so much, Dr. Subramanian. So it was wonderful delight for discuss on learning objectives, electricity of heart, the wiring diagrams of heart, the shape of ECG, ECG interpretation, normal sinus rhythm, and more. So now I would request to the admission nominee, Mr. Rishabh Sharma, to be on the screen. Over to you, sir.
Thank you so much, Dalvinder ma'am. Further, I would like to extend my regards to Dr. Saab for enlightening us with the facts about how to read ECG. Thank you, sir. And moreover, sir, I would like to request you if you can stop sharing your screen.
Yes.
Yeah, thank you, sir. So today we will be discussing about accreditations, approvals, rankings, infrastructure part of the university and programs. So without wasting much of time, we will be discussing all this. I will give you glimpse of each and everything. Just give me a second. I hope my screen is visible.
Screen is visible. You can continue.
Yeah, just give. Okay. So it gives me immense pleasure to announce and share with you all that LPU is now NAC grade A++ university with 3.68 score on 4-point scale. It is highest score in first cycle of accreditation among all government and private universities. So if we move further, we are also having approval from ICAR, NCTE, and Council of Architecture, Pharmacy Council of India, Bar Council of India, then Indian Association of Physiotherapists, town planners. List is long. You can have a look. If we move further, if we talk about ranking and awards, the world universities ranking 2023, LPU has been ranked 23rd among top universities of India, both government and private. So if we move further, the world universities with real impact ranking, we have been ranked second. And if we talk about Atal ranking of institutions of innovation achievements, LPU has been ranked third. If we talk about exposure and extracurricular activities, LPU creates history. 12 out of 13 LPU students won Olympic medals, won, won Olympic medals in all three categories, gold, silver, and bronze. If we talk about extracurricular activities, LPU is a lovely professional university, champions of 37th National Inter-University Youth Festival under the aegis of Association of Indian Universities, New Delhi. We have been excelled in all the departments, whether music, dance, theater, possession, literary, fine art. Lovely professional university won national sports award. We were ranked first runner-up. It was awarded annually by Ministry of Youth Affairs and Sports, Government of India. Our students shined at 19th Asian Games. Neeraj Chopra gold medal in javelin throw. If we talk about Abhishek, gold medal in archery. See the level of exposure at LPU. LPU successfully hosted 106 Indian Science Congress, which was inaugurated by Honorable Prime Minister of India, Shri Narendra Modi. His Holiness Dalai Lama in lovely professional university campus interacted with students. Two former presidents, Mr. Hamid Karzai of Afghanistan and Pranab Mukherjee, along with our worthy Chancellor Sir Dr. Ashok Kumar Mittal, Member of Parliament, Rajya Sabha, then Finance Minister of India, Shri Arun Jaitley ji, Venkaiah Naidu ji at convocation, Gohar Gopal Das, then many Bollywood celebrities also visit LPU campus from time to time. MS Dhoni, Sonam Kapoor, Prabhu Deva, Sonu Sood, Ranveer Kapoor, Akshay Kumar, Jacqueline Fernandez. LPU also hold one Guinness Book of Record in its name uh, for highest number of people doing Bhangra at a single venue. This is infrastructure of university. You can have a look. We also have Shanti Devi Mittal Auditorium with sitting capacity of more than 2,500 under one roof. Library. We can you can see labs are available. Library is available. Uni Mall. You can get all your essential needs fulfilled from this particular mall. If you talk about basic needs, gymnasium is there, bowling area is there. We also have 50 bedded hospital in university campus. This is the outer view of lovely professional university. And then lush green campus, we have also been ranked as the cleanest and safest campus. Night view of lovely professional university. We also have indoor stadium facility. We have badminton court, squash, basketball, volleyball. Uh, Even we have Olympic size swimming pool. This is the outer view of indoor stadium. I would like to share this video with you. It will take 2 minutes of yours. Please pay attention. So let's move further. Further, I would like to discuss with you study grant. This is a very special feature in lovely professional university. If you want to take admission into medical program, you need to appear for LPNS exam. LPNS is lovely professional universities, national entrance and scholarship test. This test serves the purpose always encourage meritorious students. So if you are preparing for NEET and you have given NEET exam and you are among top 100 candidates study in AIMS, government universities and colleges, central or state. If you have qualified LPNS exam and you are among top 100 and you have qualified NEET and you got seat in MBBS in any of AIMS, government university or college, state or central, you will be eligible for 1 lakh rupees one-time study grant that LP will give you to study there. Okay, so now let's move further. Let's go live and discuss. Just give me a second. Yeah. Now you can see my screen. Website is opened. You can note our website address that is www.lq.in. I am repeating it for you www.lq.in. Now you can see I have you need to go to admissions. Once you will go to admissions, there you can select after 12th or after graduation, post after graduation. See, I have selected already after 12th. Then I have selected the discipline that is applied medical sciences. Under that, we have different pharmaceutical sciences, physiotherapy, medical lab technology. So I have clicked here on physiotherapy. Then under, I have selected the program that is Bachelor's of Physiotherapy. This is a 4.5 years program, 9 semesters are there. If we talk about the eligibility of the program, you eligibility says you must be passed with 60% marks in 10 plus 2 with English, physics, chemistry, and biology as subject, subject to qualifying LPNS or CUET exam. Now, if we talk about the fee structure of this particular program, fee structure is 80,000 per semester. Now, you can get scholarship up to 40% in this program. You can get scholarship on the basis of LPUNES. You can get scholarship on the basis of your 12th percentage. If we move further, you can get scholarship on the basis of your CUET exam, as well as you can get scholarship on the basis of NEET exam. Then we are also giving scholarship on the basis of sports, cultural, research and development, co-curricular, social bravery, social services, bravery awards. If you are board topper, then also you can get scholarship. Then we have financial aid need-based scholarship available under this program. We have scholarship for defense personnel and their wards. We have scholarship uh, for orphans. We have financial aid for persons with certain disabilities. So if we talk about the important dates, online registration already started from 1st of April. Slot booking started from 6th April onwards. Last date to apply for LPUNES and slot booking was 30th of April. Entrance exam date is 15th of April to 4th of May. Result of exam would be announced on 6th of May, and there will be round of counseling 6th May to 4th May to 7th May. You need to fill your online seat preference. Then on 8th May, your allotment letter would be announced, and from 8th May to 15th May, between 15th May, you can take admission in this particular program. So now there will be a question in your mind that what is the fee structure for LPNS and how we can apply for this program, for this entrance exam. So fees for boys is 1000 rupees if you apply without kit, and for girls it is 1000 if you opt for without hard copy of LPNS kit. So now how to apply for this particular program? Simply you can click here, apply now. Otherwise, direct link is admission.lpu.in. I'm repeating it for you. You can note admission.lpu.in. Here you need to register yourself, and your dashboard will be created. Under your dashboard, you can apply for LPNS program, and from your result will be announced here only in your dashboard. You can check seat preference will be filled here only, and after that you can check your allotment letter in this portal only, and from this portal itself you will be able to take admission as well, so your provisional registration. So from here you can do this thing. If you want to connect with us, you can schedule a call by clicking here. You can chat with us on WhatsApp. If you want to have live video counseling with us, you can always click on this through Zoom. You can connect with us through video call, and you can get your doubts cleared with us. So this is all from my side. I hope I have cleared uh, all the questions, and I have covered all the important points. So over to you, Dalvinder ma'am.
Thank you so much, Mr. Rishabh. Can we take questions, Dr. Subramanian?
Yes, ma'am. Yes, of course, ma'am.
Thank you so much. Thanks for giving me a chance to address your questions. First question is, how can an ECG be used to diagnose heart conditions?
Yeah, of course. That's a very nice question to ask. Every one of the students are asking the same scenario. As I told already in the simple understanding of the wave pattern, if there is a tall wave, always it should be with the equal gap between the each tall wave to next tall wave. So I'm not using the much technical term here, because so people who are watching this video may be a beginner to this profession, or maybe a school student, or maybe a participants or parents. So you can always see that when the tall wave in a one particular wave to next tall wave, and the adjacent consecutive tall wave, it should be equal in distance. This is a simple thing where there will be easy to identify by every one of us.
Thank you so much, sir.
Though we have many steps are there, but I'm
Yeah.
just giving the nutshell.
Yeah. But Megha is the same asking here, are there any risk associated with undergoing an ECG? This is very important. It's in my mind also.
Of course, ma'am.
Yeah.
So there are risks in the sense, one is that people who are already having the symptoms of chest pain. As I told already, there are symptoms of the pain below the ear. People always say, sir, left side only heart is there. So I don't bother about right side pain. No. Anything below this ear, if you have a sound pain of the pain, persistent pain. Okay, if it is a movement pain, many people having working desktop workers, they will get a pain on the neck because of the some different position of the head, or sometimes they get the pain. That is we don't require to bother. So when the pain is subsequent pain and compressing pain or chest heaviness of the chest or band-like pain, so then we have to identify those are all the risky population to check for the ECG.
Thank you so much, sir. I hope all the participants got their answers from our expert, Dr. Subramaniam. Thank you so much once again. As we come to the end of this webinar, I want to express my deepest gratitude to our experts for sharing their valuable insights and expertise with us. Your presence, enthusiasm, and active participation have made this experience truly special. Hopefully, the attendees found this webinar to be valuable and will be able to utilize the information for better decision making regarding their admissions. If anyone wants to access this webinar again, they can visit our website, that is lpu.in, or can be accessed on YouTube also. Stay connected with us for future webinars. Until we meet again, with the permission of my seniors, I would be signing off this webinar. Take care and goodbye. Have a beautiful day. Thank you so much.